Let me paint you a picture. You are 76 years old. You feel good? You sleep well? Your energy is decent. You are doing the things you love. You go in for your annual physical. Routine, nothing special. Your doctor glances at your chart and says, let's just run a few tests to be safe. 6 weeks later, you are sitting in a surgeon's office. Not because anything was wrong with you, but because those just to be safe tests found something. And that something set off a chain of events your body at 76 was simply not equipped to handle. That exact story plays out more often than the medical system likes to admit. And the data behind it deserves a serious conversation. What I am about to share doesn't come from a single textbook. It comes from years of studying the medical literature and paying close attention to what the evidence actually shows when the system runs on autopilot. Here's the truth that most doctors won't say out loud in a 15-minute appointment. After the age of 70, some of the most common routine medical tests can cause more harm than good. Not because medicine is broken, but because the risk-to-benefit math changes dramatically as we age. And nobody is doing that math in the room with you. Today, I am walking you through 5 specific medical checkups I would personally reconsider after 70. I will tell you why the math changes. I will share what I have seen happen to real patients. And at the end, I will give you a set of questions that will completely change the dynamic in your next doctor's appointment. Stay with me through all 5, because number 3 has stopped many people in their tracks when they first hear it. And number 5 is the one most people have never even heard of until it was too late. But before I get into the 5 checkups, I need to give you one concept, because without it, nothing I'm about to say will fully make sense. I call it the longevity lens. When you are 50, screening medicine works beautifully. You find a problem early, you treat it, and you potentially buy yourself 30 more years of healthy life. The investment is worth it. The math is clean. But here is what changes after 70. 3 things specifically. First, many conditions detected by routine screening in older adults will never actually harm you. They grow slowly. They cause no symptoms. You will likely outlive them. But once they show up on a report, medicine doesn't have a leave it alone and watch button. It has a treatment button. Second, your body's tolerance for intervention drops with age. The surgery that a 55-year-old bounces back from in 2 weeks, that same surgery in a 78-year-old can mean months of recovery, complications, loss of independence, or worse. Third, there is something called the cascade effect. One test finds a small abnormality. That triggers a follow-up scan. The scan recommends a biopsy. The biopsy leads to a procedure. The procedure causes a complication. And suddenly, a person who walked in feeling perfectly healthy is navigating a medical nightmare. All started by a test they didn't need. That is the longevity lens. Keep it in your mind as we go through each one. Checkup number 1. Routine colonoscopy after age 75. I want to tell you about a patient, a 77-year-old woman, retired teacher, sharp as ever. She had had 2 colonoscopies in her 50s and 60s, both completely clean. No polyps. No family history of colon cancer. No symptoms whatsoever. But her new doctor looked at her chart and said she was due for another one. She had concerns, but she didn't want to seem difficult. So she went. The prep, the liquid you drink the night before to clear your bowels, hit her kidneys hard. By the next morning, she was confused, dizzy, barely able to stand. Her daughter rushed her to the emergency room before she ever made it to the procedure. She was severely dehydrated. Her electrolytes were so dangerously low her heart was at risk. She spent 4 days in the hospital. She never had the colonoscopy. And the painful irony, she didn't need it. The United States Preventive Services Task Force officially recommends against routine colonoscopy screening for average-risk adults over the age of 75. The evidence is clear. After 75, if you have no symptoms, no family history, and clean previous scopes, the risks begin to outweigh the rewards. And those risks are real. Bowel perforation, a literal tear in your colon, occurs in approximately 1 in every 500 colonoscopies. In a younger adult, that is a manageable complication. In a 77-year-old, it can mean emergency surgery, extended hospitalization, and a recovery that fundamentally changes your quality of life. What to do instead? Ask your doctor about a non-invasive stool-based test. These can flag genuine warning signs without the procedural risks. And if you do have symptoms, blood in your stool, unexplained changes in bowel habits, that changes the equation entirely. See your doctor immediately. Checkup number 2. Aggressive cancer screening in average-risk patients over 75. Let me be very precise here, because this topic deserves nuance. I am not saying never check for cancer. Cancer screening has saved millions of lives, and it can absolutely save yours. What I am saying is this. After 75, aggressive cancer screening in average risk, asymptomatic individuals has a serious overdiagnosis problem. And overdiagnosis leads directly to overtreatment. Here is what overdiagnosis means in plain language. Imaging technology today is so sensitive that it can detect cancers that are, biologically speaking, barely awake. Tiny, slow-growing tumors that left alone would never spread, never cause a symptom, and never shorten your life. You would die with them, not from them. But the moment a radiologist writes the word malignancy on a report, the clinical machine turns on. Biopsies, specialist referrals, treatment decisions, all of it moves forward regardless of whether the cancer actually poses a threat to you. I had a patient, a 79-year-old man, sharp, independent, still fishing on weekends. Routine screening found a low-grade, slow-moving cancer. His specialist recommended treatment. He trusted the recommendation. Within a year, he was dealing with chronic fatigue and a quality of life that had dropped dramatically. Looking back, his cancer was the kind a man his age would almost certainly have lived alongside, not died from. Studies in the New England Journal of Medicine found that a substantial portion of cancers detected through screening in patients over 70 were clinically insignificant, meaning treatment offered no survival benefit, only side effects. What to do instead? Have an honest conversation with your doctor about your specific risk profile. If you have a family history, genetic markers, or symptoms, screen. If you are average risk with no symptoms, ask your doctor directly. If we find something, what are the realistic treatment options at my age, and what would we actually recommend? That question alone often changes the entire conversation. Checkup number 3. Routine cardiac stress testing without symptoms. This one surprises people because it sounds so logical. Your doctor says, "You are 72. Let's just make sure your heart is doing okay." You hop on a treadmill. Sounds benign. Sounds responsible. Here is the problem. Cardiac stress tests in people without symptoms have false positive rates that can reach 40% or higher in certain populations. That means nearly half the time, the test flags an abnormality when your heart is actually completely fine. But medicine cannot just shrug at an abnormal finding. That false alarm launches you into the next phase, a cardiac catheterization. Catheterization means threading a thin tube through your blood vessels, directly into your heart. It is a serious procedure. Risks include bleeding, vessel damage, arrhythmia, and in rare cases, it can trigger the very heart attack you are trying to prevent. And here is where it gets even more counterintuitive. If the catheterization finds a partial blockage, which is extremely common in adults over 70 who have no symptoms whatsoever, you may end up with a cardiac stent. Multiple landmark clinical trials found that stenting in patients with stable coronary artery disease did not reduce heart attacks or extend life compared to medication and lifestyle management alone. Let me say that again. The stent didn't help more than the medication. But it carried real procedural risks, and then a lifetime of blood thinners with their own complications. So you've gone from feeling fine, routine test, false alarm, catheterization, stent, blood thinners, ongoing monitoring. And you are no better off statistically than someone who simply managed it with medication and a daily walk. What to do instead? If you have no chest pain, no unexplained shortness of breath, no dizziness during activity, talk to your doctor about optimizing your risk factors instead. Blood pressure, cholesterol, blood sugar, activity level, sleep. That is where the real gains are. Checkup number 4. Routine bone density scanning with automatic medication. I need to be careful here, because osteoporosis is real and falls are devastating in older adults. So let me be clear. I am not questioning the reality of bone loss with age. I am questioning the automatic pipeline that often follows a bone density scan result in patients over 75. A scan detects low bone density. Your doctor prescribes a bisphosphonate, medications like alendronate or risdronate. You take them for years assuming you are protected. But here is what often goes unmentioned. Long-term bisphosphonate use has been associated with a rare but serious condition, atypical femoral fractures. Spontaneous stress fractures in the thigh bone, the very bone you were trying to protect. Meanwhile, the most effective intervention for preventing fractures in older adults, bar none, is not a medication. It is fall prevention. Balance training. Studies show Tai Chi specifically reduces fall risk by nearly 50%, removing tripping hazards from the home, installing grab bars, checking for medication side effects that cause dizziness, getting vision checked regularly, ensuring adequate protein and vitamin D. These interventions reduce fracture risk more meaningfully than any pill, with zero side effects. I am not saying never take medication for bone health. There are absolutely patients who need it. But a routine scan leading to automatic long-term medication for an active 74-year-old who has never broken a bone? That is a conversation worth having, not a foregone conclusion. Checkup number 5. And this is the one almost nobody is talking about. Asymptomatic carotid artery ultrasound screening. A carotid artery ultrasound checks the large blood vessels in your neck that carry blood to your brain. The idea is simple. If we find a significant blockage, we can surgically clean it out and reduce your stroke risk. Logical, right? The reality is far more complicated, and for asymptomatic patients, far more dangerous than it sounds. Here is the key fact. The surgical procedure used to treat a carotid blockage carries a 2 to 3% risk of causing a stroke during or immediately after the procedure itself. In older adults with other health conditions, that risk is higher. The United States Preventive Services Task Force explicitly recommends against routine carotid artery screening in adults who have no symptoms. Their analysis found that in asymptomatic people, the risk of surgical harm outweighs the benefit. Here is why. Many people over 70 have some degree of narrowing in their carotid arteries. That narrowing has often been there for years, stable, silent, not causing any problems. When you screen for it routinely, you find it. And then a well-meaning surgeon recommends fixing it. But the surgery to fix a blockage that was never causing symptoms can and sometimes does dislodge a tiny piece of plaque that travels directly to the brain. The medical literature shows people walking into a routine screening appointment and leaving on a completely different trajectory than they ever imagined. Not because of the blockage that was found, but because of the intervention that followed. What to do instead? If you have no symptoms of stroke or TIA, the far better investment is controlling your actual modifiable risk factors. High blood pressure, the single biggest stroke driver, blood sugar, smoking cessation, atrial fibrillation management, and staying active. If you do have any neurological symptoms, even brief ones that resolved, get evaluated immediately. That changes everything. Now, I promised you something practical. 5 questions that will completely change your next doctor's appointment. Write these down. Put them in your phone. Bring them to every appointment. Question 1. What is the false positive rate of this test in people my age? This tells you how likely the test is to trigger unnecessary follow-up procedures, even if nothing is actually wrong. Question 2. If this test finds something, what are the realistic treatment options for someone my age and health status? This forces the conversation toward outcomes, not just findings. Question 3. What is the procedural risk of any treatment we would likely pursue? Every procedure has a risk. You deserve to know it up front. Question 4. What happens if we monitor this instead of treating it? For many conditions found in older adults, watchful waiting with regular monitoring is a legitimate and often superior option. Question 5. What is the most effective non-invasive intervention for this condition? Because very often, as with bone health, heart health, and stroke prevention, lifestyle and medication outperform procedural intervention with far less risk. Any good physician will welcome these questions. They will respect you more for asking them. And if your doctor dismisses these questions or makes you feel difficult for raising them, that is important information about whether that doctor is the right fit for you. I want to close with this. There is a difference between medicine that finds things and medicine that helps you live well. After 70, the goal of your healthcare shouldn't be to generate findings. It should be to protect and extend your quality of life, your independence, your energy, your ability to do what matters to you. The best physicians understand that doing less sometimes takes more wisdom than doing more. That recommending watchful waiting requires more courage than ordering another scan. You have the right to know what a test is looking for. You have the right to know what happens if something is found. You have the right to ask whether that finding would actually be treated and whether that treatment would genuinely improve your life. Medicine has given us incredible tools. But tools are only helpful when they are used in the right context, at the right time, for the right person. You are that person. And you deserve healthcare built around your goals, your values, and your body, not around a checklist. I hope this has been helpful. Stay well, and I will see you in the next video.